Unit 5, General Preparation for Administering Food or Medication per Feeding Tube. A. Preparing the work area. 1. Wash your hands and clean the work area to help prevent infection. 2. The surface used to prepare the tube feeding or medication should be clean and dry. If the work surface is washable, clean it with soap and water and dry with a clean cloth or paper towel. If the work surface is not washable, wipe it free of dust and spread a clean towel or paper towels over the surface. Avoid using food preparation areas. 3. Choose a work area away from household traffic and pets. 4. Wash your hands thoroughly with soap and water for 15 to 20 seconds. Put on gloves. B. Positioning of the individual. 1. Position the individual sitting up or with the upper body, trunk, elevated greater than 45 degrees for verifying tube placement and for bolus and intermittent feeding. 2. Allow them to remain in this position during the feeding. 3. For continuous feeding, the individual either needs to be sitting upright or with their upper body, trunk, elevated greater than 45 degrees. For positioning is very important. Individuals receiving feedings and medication by feeding tube can aspirate. Food or medicine gets into their lungs if lying down or not upright enough during feeding or medication administration. 5. The delegating nurse will provide you with specific instructions regarding the proper positioning of an individual. C. Verification of tube placement. There are 3 ways for DD personnel to verify tube placement. Each of these should be done with the individual sitting upright, or at least with trunk, upper body, elevated greater than 45 degrees. The delegating licensed nurse will provide you with individual-specific instructions. 1. Check for tube graduation marks if present. If the tube is not marked, the delegating licensed nurse can make a mark with a dark, non-toxic pen at the point where the tube exits the body. If the length of the tube is less than or more than normal, notify the delegating licensed nurse or individual's physician. Demonstrate. 2. Aspirate and monitor gastric residuals with a syringe. The delegating nurse will provide specific instructions if you need to do this task. Attach 60 cubic centimeters syringe to unclamped end of G-tube. Aspirate small amount of gastric contents through the tube. Observe for color of contents indicating proper placement, clear, tan, light green, or brown. To prevent possible electrolyte imbalance, return residual volume once color and amount are noted. 3. Inject air into the unclamped tube with a syringe and listening for air bubbles in the stomach with a stethoscope. D. Problems with verifying tube placement. 1. If you are unable to verify tube placement, or if you have questions or concerns about the tube placement, contact the delegating licensed